slowly here, you can actually see there's not much of colloid there. Okay, okay, right? And you can see some follicular cells. That's actually the lowest. Okay, sorry. Okay, you can see some follicular cells. That's too bright, is it?
Rizal, we can't see you, Rizal. Oh, okay. Slowly, Rizal, slowly.
Do
Okay,
you
okay,
see
okay,
that?
okay.
Right? You can see some follicular cells that look very benign looking. Okay, this is still considered flat sheets, right? Okay, and I'll show you the MGG. There's not much of celerity that in that in the PEP. Okay, now I'm a bit lost. Okay, but just to show you, okay, this area, okay, and a bit of high power of this area, right? So can all of you? That's my WhatsApp. Okay, can all of you give your ni now? It's actually in the WhatsApp.
Hello, Rizal, can you put up the link?
The link is in WhatsApp.
Yeah, I can't see it yet.
Ada. Dah dapat? Oh,
Tak dapat, Rizal.
a bit of
Okay, we just got it.
okay. So basically, if I can just recap it to you, the first case, okay. So you can see actually there's actually so sorry, the first case is actually different. I get 613. Oh sorry. 613. Yeah. Okay, you can vote for the first one.
Rizal, tak dengar, Rizal.
You can vote for the first one. Okay, what do you guys think? Okay, so I can actually see what your vote. Okay, right. So let's have a look a bit. Okay, majority of you say it is category 2. Okay, this is actually case number 5. Right, so let's have a look a bit. So what you can see is actually I mean, the thing is actually when you see the celerity is not that many, but still fits the more than 6 follicles. Colloid is not that much. You can see quite well. This is rather macro follicles. The cell is not that not that bad looking. Okay, and you can actually see the big cluster is actually, you can see it has a lot of cytoplasm there. Okay, right? Can you see that? Okay, the nucleus is actually very benign looking. All right, so basically majority of you did say it is actually category 2. Okay, so I agree it is actually category 2. Right, I do not have any follow-up. Basically for category 2 they don't do any resection, but there is actually category 2. Okay, all right, I'm going to the second case. Now the second case has a lots of blood, right? But the area that I want you to focus is particularly this area. Can you see that? Nampak tak?
Tak nampak.
Tak nampak langsung?
Alah, baru nak nampak. Okay.
It'll take some time
Jangan
because
goyang-goyang, Rizal.
the transfer rate is actually quite slow. So basically, you can actually see there's actually a tissue fragment there. Okay, but the thing is that there's no obvious papillary looking of it. But the most important thing is you can see there's a lot of these micro follicles. Okay, can you see that? There's a bit of them is actually in the dispersed pattern. Okay, some of them are in the micro follicle pattern. Okay, so let's let's try to vote. Oh God. Next one. Dapat tak the vote? Did you get the link? Okay. So if I want to recap the case, this is actually case number 1. Okay, you can actually see there's actually tissue fragment there. There's a lots of dispersed follicles. Okay, right, and there's a lots of micro follicles, right? And in higher power, this is all micro follicles. Okay, in MGG, it looks like this. Okay, even though it looks it's actually a fragment of them, but majority of it are actually micro follicles. So your preferable diagnosis is category 4. Category 4 is SFN. Okay, majority says category 4. Okay, so basically in this case, there is also no follow-up histo, but basically I also agree that this is actually a category for SFN. Okay, all right, we go to the next case. The next case is going to be very easy. As usual, we just have a look of the PEP. You can actually see there's actually lack of colloid. Okay, celerity wise in the PEP is not that great, but there's actually a lot of. Well, this is basically straightforward. Can you see that?
Give
You
us a
nampak ini?
minute. It's there, but it's not clear yet. It's baru nampak.
Okay, nampak right?
Nampak dah.
And I can show you another fragment. Small fragments, but it is actually very typical. Okay, you can actually see from here already the how does it look like the pattern wise. Okay, even though usually we just look the pattern in the apa nama? Oh God. Even though we use terus. Okay, I'll show you another one. Okay. Okay, and you
Oh, I
can
see mitosis.
yes, can you appreciate that?
Yes, we can see
Yes,
it quite
okay.
nicely.
Right, and then let's look at the MGG, which is actually the one that gives you the biggest clue. Can you see that?
Ooh, papillary structures.
All right. Not that. I mean, I usually say usually a papillary structure usually have its own spaceship, and there's always their small spaceship that follows it. Okay, so that's actually the characteristic
Kejap, kejap
morphol
Rizal, kejap Rizal.
pattern
Spaceship-spaceship
lah.
lain tak sempat nak ikut you ni.
Ah,
Baru nampak, baru nampak.
okay, so let's vote. Okay. Wait, I give you the ini. Oh, okay, the new one. You okay? It's starting already. So
Okay,
let's
link is up.
recap. Let's recap. Case number 2. Okay, you can actually see that fragments. Okay, you can see the nuclear feature, right? Right. The nuclear feature is there, right? Is also there. Cellularity wise, impact is actually quite cellular, but it's actually dispersed in all slides. But the most cellular one is actually in the MGG. You can actually see the architecture, and also you can see this center thing called as fibrovascular core. Right. So let's see what's your uh, diagnosis. Hmm. Quite a number are not so confident to call it as PTC, but basically because of the celerity from what I've seen is actually quite high, so that's the reason why I put it as PTC itself. And the follow up, with the follow up, apa nama? Histo is actually PTC. Okay.
Sorry,
Alright.
Rizal. Were there any intranuclear inclusions? Because I couldn't make them out just now. I
There
saw
was,
grooving.
but the thing is that this thing is actually quite doesn't. Can you see that one there? There's actually some groove there. There's
Yeah,
inclusion there.
I can see the grooving, but I just
Uh,
wondering if there were any inclusions.
There's an inclusion there, but there's not many. There's one there.
Oh, mana?
Okay. Hmm?
Mana?
Like tu.
Oh, tu.
Ah. Okay.
Dah nampak, dah nampak.
Okay. So basically,
Dah.
for this case, you can actually put it as SFN, but because the celerity is quite high, and this reason I put it as category 6 as PTC. Okay. The next case is uh, so, all right. The next case. So there's not much of colloid again. Okay, very basically just thin colloid. Okay, there's quite a number of
Hang on,
follicles.
Rizal, we're not there yet. Okay, baru nak nampak.
Okay, quite a number of follicles. Majority are in micro follicles. Okay, you can see some overlapping there, but this is basically sometimes a feature in microfollicles, because you have to remember when we aspirate follicles, it's actually a 3D object. When we actually press it with the cover slip, basically we can actually see some overlapping, but this is not particularly on overlapping of a neoplasm. Okay, so the another PET. Okay, shows this. Okay, this is a bit different because, can you see that? Can you see that?
Yes, yes, we can see that.
Okay.
It's quite clear.
Right. So basically, there's not much of colloid. There's basically microfollicles. Okay, but there's some microfollicles as well, but majority are microfollicles. So let's see what is your um, preferences of diagnosis. Let's have to do this one by one. Copy this in. So it's in already. You can vote. So let's recap. So this is actually case 3. You can actually see there's actually uh, okay. There's actually minimal colloid. There's actually cell. Sorry, this is not case 3. This is case case 4. Sorry, my case jumbled up already. So this is actually what you see just now. Okay, quite big cluster, and there's actually some area that look very dispersed looking, but it is still macro follicles. Okay, again, this is macro follicles, a bit of overlapping you can see there as well. And I forgot to show you the MGG, but the MGG shows you a bigger tissue, a bigger fragments, but basically the cells are all benign looking. Okay, so let's see what's your diagnosis results. Majority of you see category 4. I suppose because showed to you, I've shown to you the dispersed and small microfollicle, but you can actually see that is actually not the majority thing. The majority of it are actually still the macro follicles. Okay, so this is actually where microfollicles and microfollicles give you the cutoff point to give you the diagnosis of category 2. If you have a little bit more of micro follicles, probably you might want to opt AUS or FLUS. But basically, when there's a lot more macro follicles than micro follicles, and the follicle cells are actually benign looking, then you actually want to opt for category 2. So even though majority of you did say it's actually category 4, this is actually a category 2 case. Okay, and the cellularity is not that great. I mean, it's not more than it's actually more than 6 clusters, but not as cellular for SFN. SFN versus category 2 is actually a lot more cellular than this. Okay, all right. So let's go to next case. Okay, next case is 398. Okay.
Rizal, Rizal,
Yes.
there's a suggestion. I
Ah.
think somebody is asking to see the still slides properly, the pictures you've taken,
Huh?
and they need a breather to digest before they vote.
Bigger what?
Dia nak tengok your virtual slides, lepas tu nak tengok
Oh,
the pictures that you took, lepas tu dia nak digest sekejap, lepas
oh,
tu baru dia nak vote.
I'm too fast, am I? Okay. So, okay, let's look into the slide further. Okay. Let's go. Let's not go too fast. First of all, this next case. Oh, I forgot to tell you guys the history already. This is actually a 39-year-old female. Okay. Celerity wise is actually not that great. Okay. I'll show you the mark area. Okay, so celerity wise is not that great, but this is among other cellular. Can you see that?
Yes, we can see it quite clearly.
Right. You can see that the cell has a lot of the nuclear features that make you think that this is something neoplastic kan? Okay, that's one. Number two, okay, even though this is a bit right off, bad, but can you see that?
Jangan goyang.
Sabar, sabar, sabar. Can you see that?
Okay, it's just turning clear.
All right.
Inclusions ke tu?
Yes.
Slownya Rizal. Tak
Apa
dengar.
dia Moha?
Slow tak dengar. Sabar jauh bah.
Dengar dah.
Mai dekat sikit.
Ni I letak dekat ni dekat apa? Dekat baju. Dengar?
Okey, dekat-dekat baju dengar
Okay.
sikit.
So that is actually the nuclear feature. Okay, there's not much of colloid again in this smear. Celerity wise is also not so great. Okay, but you can see all this nuclear features there. And then the MGG, okay, is a bit more cellular. Wait, a bit more cellular, and you can see all this. Can you see that? Remember the spaceship
yes.
that I showed you before? This is actually the anak-anak of the spaceship. Can you see that? The MGG is actually a lot more cellular than this. Okay, and even though it is actually not that advisable to look into the nuclear feature in MGG, but well, sometimes you can't be. I mean, beggars can't be choosers, right? But we need to have a look of it. Can you see the nuclear feature?
Yes.
All right. Okay. So let's look into um, the apa? The captured image. This is case number 3. Okay. Case number 3. Okay. This is actually one of the fragments. Okay. You can see that. Okay. Actually, I need to do this now. You can see that, right? And then you can see the almost dried up fragments, but you can see the inclusion there and there. But the MGG is actually the one that has a lot of celerity. There's no straightforward fibrobascular core, but there's a lot of papillary-like features. Okay, and even because of the celerity in the PEP is not that great, but what we have in the MGG, we just have a look of the nuclear feature lah. Okay, so you guys ready to poll?
Yes, we are.
Okay, it's a bit slow more kan?
Jangan laju
Alright,
sangat.
laju sangat tadi. Okay, so let's vote. Okay, okay, okay. It's in. I give you 1 minute. Okay, vote now. Let's recap back. That's the PEP. That's the cellular feature. Mind you, it is actually not that cellular in PEP. It's quite cellular in MGG, but this is the only slide that I have. Okay, and the nuclear feature, the MGG is like that. Okay, 1 minute. Should put a timer. Okay, dah 1 minit kot. Right? So semua orang dah vote. Let's see the results. Okay, majority of you put category 5, category 6 and category 3. Okay, I do not have the histology follow up for this case, but basically what I reported is actually category 5. Okay, I'm not confident enough to put it as PTC per se, because celerity wise is not that great in PEP. MGG yes, but there's only one slide only. Okay, so basically this is actually I've reported is category 5, but I suppose, I don't have the follow-up histo, so I'm not sure what is the real diagnosis, but it looks a lot like a papillary carcinoma lah. Okay, all right, so we go to the next case. The next case 87. Okay. One minute there. Sometimes when you arrange your slide, sometimes your slide hilang. Macam mana? HP 18. Oh no. FN 17.5. Okay. Alright. This is actually 25-year-old female. Sorry. 25, yeah. 25-year-old female. Again with a neck swelling. Okay. This is interesting because it was given as
Rizal, can you take
Tyrex.
down the poll?
Sorry. Poll. Okay. This was given as Tyrex 4 actually, right? Tyrex 4 is actually suspicious for carcinoma for their level, but basically this is actually done under ultrasound guided. Okay, it is not that cellular. Okay, you cannot see that much of a colloid as well, but I guess all of you know what are the majority of the cells that we can see there. Okay, just focus a bit. Okay, see the let's go high power. Can you see the cells?
It's still a bit blurry. Wait a minute. Can you focus a bit for us, Rizal? It's a bit.
Dah focus ah.
Oh, okay,
Ah.
a bit better.
Okay.
They look like hemosiderin-laden macrophages or something.
Yes. Okay. So basically, there's not much of a cells. There's actually one thyroid follicles yang keseorangan di situ. Okay. Right. There's also some because some of majority of the follicles. This is the thing when you give your response to iridologist, because radiologists tend to put their needle in too long into the thyroid gland. So when they put it too long, there's a lot of blood, and what attracts blood is actually the follicles. And when it comes to follicles staying with the blood, you cannot really actually give your you cannot really see the cellular feature in the microscopy. So basically what I'm trying to show you now is actually can you see that? It's a bit dark.
It's a bit, yeah, okay. Now it's okay.
This is actually a thyroid follicle. I mean, this is not a giant cell. This is thyroid follicle still, and you can see the benign one are there attracted to the blood, and you can see there's macrophages still there. Okay, let's see the MGG. Okay, now the MGG shows a little bit more of the colloid. Okay, this is all thin colloid. Okay, quite a number of cells
Slow
again.
down, Rizal. Slow down.
Again, this is blood, fibrin. That's reason why all these follicular cells follow it. But let me show you one area. Wait, one area. Okay. Is there comments from the audience, ni? Ini?
So far. Hang on. We have 3 comments.
Okay, can you see that?
Okay, wait a minute.
Can you see that, Idi?
Nampak. Allah tu
Sekejap, I focus lagi So the cells is actually quite benign looking, even though it's dispersed, but this is not majority of the majority of it. Okay. Okay, majority of it are like this. Okay. Okay, you can see that, right?
Yeah.
Right. Okay, and this. You can see that, right?
Yeah.
Those are all microfollicles. Okay, so let's vote. Back, create poll. Okay. Okay. Alright, semua orang boleh vote now. Just to recap, again, I lupa sekali lagi. Jangan vote dulu, let's recap back. So basically this is case number 7. Okay, so you can see there's a lots of not follicular cells, okay, there. This is actually a bit more blurry lah, okay. But you can see there's actually microfollicles with some degenerated colloid there, okay. More microfollicles with degenerated colloid. Okay, you can vote now. Okay, so let's see. Dah sampai seminit dah. Okay,
Okay, go
vote
on.
dulu.
Rizal, we think you have to go slower kot Rizal. Farbin dah pening dah ni.
Okay, I go slower. Ada lagi tiga je
Dia
lagi.
jadi macam motion sickness sikit tau Rizal.
Of course. Okay.
It takes a bit of time to focus. So kalau you dah sampai tempat yang you nak tunjuk tu, give us a minute.
Ya. Okay, I buat dulu nanti. 92. Okay, so let's see the results. Good. Okay, majority of you see is a category 2. Right, the celerity is not that great, but it's more than 6 clusters, even though there's not much of a colloid, but there's a lot of hemosiderin-laden macrophages. Okay, even though she's 25 years old, I might miss out that the patient had already MNG for quite some time. So that's the reason that it is actually category 2 for the diagnosis. Okay. Some of you put category 4 probably because again I show you the small clusters just now, but well, you need to have a lot more cells than that. Quite a number of you put this category 1 probably because you don't agree of the number of the celerity, but I do not have time to show all the cells. Those are the mean cells, but basically it's actually more than six clusters, and even though there's not much of colloid, that's good enough. So that's the reason why I'm giving it as a category 2. Good. Okay. So let's go to one interesting case that at least I have the histology. Okay, this is more interesting. Okay, area number 1. Wait, let me go to the area. Okay, can you see that?
Okay, we just
Alright,
about.
tengok dulu.
Yeah.
1-2 minit. 1-2 saat. Okay, let's go high power. Can you see that? This is actually PEP, yeah? Somehow or other the camera makes it a bit darker, but I'm not sure why. Okay, can you see that? Right.
Okay, okay.
From the look itself, it doesn't look like it's actually it doesn't look actually it's actually a benign lesion lah. Okay, can you see that?
Wait,
Okay.
wait, wait.
Wait,
It's
one sec, one
the
sec.
image is
Frozen.
yeah.
Better?
No, not yet. Okay lah kot. Still
Okay, ya.
adjusting. Okay,
Nampak tak?
nampak.
Okay. Right. Okay. So I'll show you the MGG. There's a lot more cluster in the PEP. Okay. Basically, the MGG. 1 minute. 1 minute. The MGG is okay. It's not that cellular. Okay, the most cellularity is actually in the PEP, but I only show you one cluster there. Okay, the only helpful thing in the MG is this one. Okay, I cannot really focus to see the cell that much because it's actually quite because of the blood. Okay, that's the reason why it becomes like that. Okay, so mind you, the cellularity of the one that I showed you before is actually very cellular. Okay, if I can show you the slide, this is ni. Wait, I forgot already. This one. Okay, this is case 6. This is a similar cluster that we see before, kan? Okay, it has some architecture as well in the PEP. Okay, but basically you can actually see there's a lot of overlapping. The nucleus is actually not that nucleus is not that similar all over. You can actually see some inclusion there and there. Okay, I did not show you. This is actually from an MGG actually, right? Some cluster of it looking like this as well. There's nuclear feature as well. A bit of cytoplasm reminds us of oncocytic type or something like that. But this is the only thing that is helpful in the MGG. Okay. Right. So let's vote. 1 minute. Okay. Create poll. Okay. Ya. Dah. Poll masuk Okay. So again, to recap, it's quite cellular, first of all. There's not much of a colloid. Okay. There's actually overlapping seen there, right? Here is being even better. You can see overlapping. Cell's nucleus is actually quite pleomorphic. You can see some inclusion there and there. Okay, and in the MGG, it's even better looking. Okay, the inclusion, and some of it has a lot of cytoplasm. The MGG architecture-wise not that helpful. This is the only thing that you get. Okay. All right. Let's see the result. Okay, majority of you says category 6. Some of you says category 5. This two is actually agreeable. I wouldn't celerity wise, even though it is quite cellular in the PEP, because of the um, the architecture is not that prominent. That's the reason why I put it as category 5 actually. Okay, but well, the reason being we cannot means we cannot really um, disregard the cytologic features of the cell lah, kan. But just to show you guys, this is the histology. Can you see that? Okay,
Yeah, okay, it's
I'm a
just
bit
coming through.
surprised. Somehow or other, our needle, sorry, the radiologist needle, did actually manage to sampai to this area. Because mind you, um, the this is the lower power. The size is actually quite small, the tumor. Okay, the rest is off, and there's a lots of lymphocytic infiltration, but this is the only small area that has the tumor, and somehow or other, the needle actually went through to this area, and you can see all those features of PTC. Okay, so you can put it as SFN. Basically, what they'll do, I'm not sure what your surgeon do there, but basically, if it's SFN, they basically do they will do the CT scan to stage the patient, and if there's a note, they take out the notes. Okay, right. So that's easy. PTC. The second last case is actually quite interesting. PTC dan option. Oh, okay. Before that, let's go to this case. Okay, this is this is interesting. This is a 46-year-old male. Okay, with thyroid nodule. Okay, so from the first look, you can actually see there's not much of colloid there.
Tak nampak
Okay,
apa, Rizal.
nampak tak?
Tak, not focused.
Not focus. Okay, let sekejap, area yang clear sikit. Nampak? There's not much of a colloid.
Okay.
The real
Don't
thick.
move.
Okay,
Wait. Allah.
but it is actually quite cellular.
Rizal,
Okay,
stop. Oh God.
nampak?
Okay. Finally you stopped.
There's a bit of lagging. That's the reason it's actually quite. But one thing that you can see there, can you see that?
Only if you stop.
Dah.
Okay, good. Okay.
Can you see the spaceship with the anak-anak of the spaceship?
Yes, very Star Warsy.
Yes. Okay. Okay. So when you look at this, obviously you would think of that CA. Okay. But it's always next thing is always about the nuclear feature lah. So the thing is that when I look at the nucleus of each of these clusters that follows the big fragments, that's not
Stop.
1 minute, belum lagi. Okay dah. Okay,
Wait.
right?
Okay.
Right. There's not much of nuclear pleomorphism. It's rather still similar looking. Okay, does not have any nuclear feature. But the thing is that some of it appears like clearing, but it is not the optically clearing that you usually see for papillary thyroid carcinoma. Okay, let me bring you to another area that is actually a bit more not less busy. 1 minute. Okay, nampak?
Ha, nampak.
Alright,
Don't move.
okay. It looks more oncocytic. The cytoplasm is a bit more. There's a bit of anisocytosis, but there's not much of differences between one and another cell. And obviously, in this case, there's no nuclear changes as well. Let's look the MGG. Okay, this is the MGG. Similarly, cellular, quite cellular as well. Okay, but one thing that I noticed, let me just walk around a bit to see is there any big fragments. There's no big fragments as in the MGG, So majority of it are actually small fragments, and quite a number of it are actually in dispersed form. Okay, right. Okay, and again, you can actually see that the cells is a lot more oncocytic, right? Okay, so this one I have the histo. We'll see later. Now let's vote.
Do you have your still pictures? Your
Sekejap.
captured
Oh, still
images?
pictures was there. Sorry.
Ah,
So
jangan lat lah
this
tu
is
Rizal.
okay. This is case. I think no. This one. Okay. Remember the spaceship with the anak-anak of the spaceship, but I forgot to show you just now. There's actually an area that looking like there's actually a fibrovascular core there and there. Okay. Nuclear wise, there's no nuclear features. Majority are microfollicles. It's a bit more similar looking. Okay, and quite a number of them has this dispersed looking microfollicles as well. And this is the MGG. Okay, clusters. Some starting to be in dispersed form. Okay, so let's vote. Okay, you can start vote now. Okay, again, let's recap. This is actually a male, a male, 47 years old. Okay, with a thyroid nodule. This one they didn't give us the thyroid category, but when they did the FNAC, it's quite cellular MGG in PEP and MGG. In PEP, somehow rather this is the fragment that we see. Okay, and then there's again, as I show you, the spaceship with the. I mean, this is not something that the one that actually teach me how to use this is actually my supervisor back in Sydney, Prof. Andrew, who actually tell that if there's a spaceship, there must be the mini spaceship that follows the spaceship. Okay, all right. But the cell is actually not that does not have nuclear features that suggest of papillary carcinoma. I'm giving you the answer. Okay, but there's quite a number of um, dispersed form. And in MGZ again, there's clusters. It's not that tight. It's actually quite loose because it's actually oncocytic looking, and quite a number of them are dispersed. Okay, all right. So let's look your answer. Category 4. Okay. Majority says category 4. Some no one says category 1. Okay. And some says category 2. But I think for this case, I would rather put it as a category 4. Okay. But most interesting is, because this one has histology. Sekejap. Silap. Tada.
Oh.
Nampak tak?
Baru nampak. Dekat sikit Rizal.
Dekat sikit. Saya bagi you dekat gila. Can you see that?
Not yet. Give us a second.
Right. So the histology is reported as hypoplasia only. So I
Aduh.
think basically, yeah, I mean, that's the thing with cytology. When you have everything is almost complete, but sometimes the story is not, but they actually appreciated that, well, they did not appreciate it, but they say they are going to take it out anyway because he's quite old and he's male, so they need to make sure it is not malignant. But apparently, this is actually just a hypoplasia. Okay.
Sorry Rizal, can I just ask, what was the patient's thyroid function status like? Was he euthyroid, hyperthyroid on treatment or anything
I
like
do
that?
not have the data here, but I think he is euthyroid because there's not many male cases I see in you can. So it's actually basically it's not even an adenoma because there is not even it's not even a tumor. It's actually part of the thyroid that become hyperplastic. This is the normal one, okay, and this part is actually the part up there is the one that become hyperplastic. Okay, so there is actually some literature that says this hypoplastic, when they become too packed, sometimes they can actually produce these tissue fragments that mimics um, the papillary carcinoma, because you can see there and there's a lot of this fibrobascular core as well, right? So, but then that one, it depends on your operator lah. If your operator suck quite good and the specimen is out there, it's okay lah. But then there's always there's always discrepancy once in a while. So you need to look a lot and learn from it. Okay. Okay. The second last case.
It looked like treated grave lah.
Huh?
Histology
Yeah,
nampak macam treated grave.
Yelah, tapi diorang put it as hyperplasia, hyperplastic. The area I show to you not entirely all yang ni yang hyperplastic, ada lagi hyperplastic attack. I tak bawa dia slide yang bawah gitu. Okay, the 39 Hanis Sahabi. This one I've shown it. Parvin has seen this case before. This is actually a 45-year-old lady with MNG. Okay, she had FNAC done before. It was actually category 2, but at that point of time, the diagnosis, the ultrasound diagnosis was thyroid 2. And they repeat the FNAC in I think about 3 to 4 months. They repeat the ultrasound in 3 to 4 months, and the thyroid has gone up to thyroid 3. So when gone up to thyroid 3, they repeated it again. Okay, there's not much of celerity here, but it's enough. It's more than 6. And somehow rather you can actually see there's not much of collite there. Okay, this is where you can actually, if I go through the whole area, this is even least collite. You can see there's few but not much collite. Okay, but the area that I want to show is basically this follicular cells. Okay, right. You can see this is the first one lah. You can see there's actually follicular cells, microfollicles.
don't move so much. We can't
Okay.
see.
Sekejap, I fokus satu lagi. Okay. Microfollicles Okay, it's all benign looking, but the most important area is this one. Can you see that? Nampak tak?
Nampak.
Don't be
There's
so
some pale
excited.
cells. Are there, Rizal?
Yes,
Ish,
don't be
dia pandang
excited
nampak
with
cahaya
this one.
granuloma pun ada. Ha. Nampak macam.
You might be correct. Okay, so let's look at the
Loma tu.
Moha. Sabarlah Moha.
Moha
Okay.
cakap apa ni?
Dia cakap slow. So this is actually the fragments. You can see basically this is all benign looking
Sabar
follicular
jauh.
cells, microfollicles, and this is the area of focus that I want to show you. But can I just take your attention? Can somebody guess what is this?
Granuloma.
Ini. Not two, this one.
Mana?
Saya. Oh, ya.
Siapa tahu ni apa?
Apa
Okay,
benda?
yes, this is colloid. This is not colloid. This is
Calcification?
ultrasound gel. It is the most annoying thing that you could see in the FNAC. Okay, tak payah nak vote lah. I think semua orang dah tahu lah kan. This is actually a granuloma. Okay, but the story does not fit of subacute thyroiditis because this is actually a nodule that has been FNA before. So basically, I put it as category 2 still. Okay, because even though there's not much of a colloid, but there's nothing there to show that it is actually a malignancy or a neoplasm. Right, the last case. This last case is actually a very long case that I did actually brought it to my supervisor to look. Okay. Okay. Celerity wise is not that great. Okay. 1 minute. Let me go to the area of interest. Mana bulatan dia? Okay. Alright. This is the area of interest. Celerity is not great, but it's more than 6. There are the MGG does not have any cell at all. Okay, can you see that? Okay.
Yes, we can see.
It's almost looking like there's actually papillary architecture. Can you appreciate that? Yes. Nampak tak?
Kejap.
Okay. It looks like a lymph node punya smear kan? It started to have this this artifact of smearing.
So it looks very spindly, does it?
Yes. Okay. And then let's focus into the area that does not have that smearing artifact. Can you see that?
Wait.
Yeah.
Okay.
Nampak?
Okay.
Can you appreciate the cells?
Yes.
Alright.
Strange.
The thing that I want you to look a bit more is actually, can you see the prominent nucleoli there?
Can.
Okay. And the cells is more to spindle shape rather than a follicular looking cells. Can you appreciate that? And it's a bit more pleomorphic than usual. Okay. I mean, it's not just a little bit more. It's actually it is actually pleomorphic actually. A smaller fragments just to show you how prominent is the nucleoli. Okay. Can you appreciate that? This is the reason why I go live, because FNAC, I mean, cytology is a 3D thing, and you can see actually these cells and then these cells, can? Betul tak?
Yeah.
So you can see the prominent nucleoli. I didn't see any mitosis in this area. But what I want to show you is the MGG. There's no cells in the MGG. What I want to show you is the cell block. Nampak tak?
Tak.
Sabar.
Jap. Komputer kami older edition lah sekejap
Nampak tak?
Oh, nampak. Macam je ni.
Okay. So this case, even though we have the cell block, okay, there's no follow up because patient died already. And then I actually took this case to Bali to show to Prof. Andrew, and he agrees with me this is actually consistent with anaplastic carcinoma or polydifferentiated carcinoma, but we need to have a proper diagnosis based on the. But I would, sorry, I didn't put the voting. So I would just put this as a category 5 because you do not have enough number of cells, and it's actually looking very pleomorphic, and it's more towards to the malignant one. Okay, and this is I do not have a follow-up HPE, but it does look a lot like anaplastic carcinoma. He also says that there's a possibility of PTC, but then because the celerity is too low, we cannot really comment. But I did ask, should we put AUS or not? He would just say it would not help the patient because some surgeons do not do anything unless the surgeon that I have in this area, after AUS they straight away do a lobectomy. But if it's like this, if you put at least category 5, they will do at least a hemithyroidectomy, and if it's confirmed to be the malignancy that needs to, I mean, usually what they do is actually they do a CT scan to make sure there's no positive lymph node, there's no lymph nodes. If no lymph nodes, they will do a hemithyroidectomy. If there's a lymph node, they will do a total. Okay, but unfortunately, this patient died, and we do not have a follow-up histo for this case. But
sorry, Rizal, do you have any immunos for this case? Did you
no,
do any?
tak ada. My cell block at this point of time, this is quite ancient, does not work with any immuno. Recent one okay dah. Recent one tak okay juga, tapi baru-baru lah. So that's unfortunate of our lab lah, because our immuno does, our cell block at that point of time does basically give all positive for all immuno, so it's not helpful at all. Okay, so I hope these cases would just give you an illustration of this is not the entire case that I have in my practice. Basically, this is probably 1/10 of the cases I have, and I cannot get everything that is interesting, because the most interesting one would be the one that have the follow-up histology. So basically, I hope with the lecture that you had from morning and all the cases that you have you get from all the presenters, this is actually a bit of practice some sort lah. Okay, you might not agree, you might agree what my invitation is. It's okay, and it depends on your practice, your own practice. Because in my center, they basically do not listen too much of our Bethesda category, but evidently when we put it as AUS or FLUS, well, basically AUS, they would just do a lobectomy if there's no lymph node, because they don't want to waste time, which is actually does not fit the purpose of putting AUS that time, because after AUS you want the nodule to be re-aspirated so that we get a proper celerity kan. But majority of them, they just cut it there, and the rate of malignancy after AUS here is exactly the same as what in previous Bethesda, the Bethesda system reported lah. Okay, so I hope, is there any questions? Heidi?
Any questions for Dr. Rizal?
I hope I'm not confusing all of you, but for for me, I think the best to especially to the trainees, if you want to, because I need to comment this, the results of the empath on cytology is quite bad last year, because I'm the host, and Dr. Farvin and Dr. Nomasiza can vouch on me because we saw all the answers. Mind you, thyroid FNA cases are not that complicated. Okay, I'm sure there's no anaplastic medullary cases. It's actually straightforward. And mind you, the benign cases is all there as well. Even though a very benign nodular goiter that does not look that looks very benign is there also in the case. Do not too excited to call everything neoplasm. And please use the Bethesda criteria, and please make sure that you describe everything, because it's 10 marks kan. So describe, do not just put it words and expect us to give you 10 marks. Obviously no lah kan. So please practice a lot. There's a lot of cases they can see in the hospital. If you do not have enough cases, you can go other hospitals like Kota Baru, things like that, probably. Okay. Anything else?
Yeah, I think you've managed to not confuse anybody, but macam ada orang macam motion sickness sikit, macam terdiam gitu.
At least kurang-kurangnya semua orang terjaga ya.
You definitely got the response when you were talking about the exam lah.
Of course,
juga mata besar.
Some questions, Hayati kata ada HPE correction, not all lah. Okay. Sorry for the name, because I thought that my microscope is good enough to show it online, but yeah, evidently Dr. Norin says her bandwidth is okay in eco probably. Okay.
Okay, thank you very much, Rizal. Thank you for a very lively, interactive session. I'm sure everybody, including myself, has very much appreciated the line